Somerset ICB's primary responsibility is to commission and ensure that there is provision in place to meet the needs of the Somerset population. Eating disorders is important because it's got the highest mortality rate of any psychiatric disorder. We're very proud of Somerset for the way that we work in partnership. We have arrangements in place for statutory and non-statutory agencies to work together to deliver joined-up care for our population of Somerset.
We started delivering the Body Project across Somerset. The aims of the Body Project is to use a cognitive dissonance approach for young people to take part in a group setting to sort of unpick the appearance ideal. And what that means is looking at who benefits from the appearance ideal, what that looks like to be the perfect woman, and then to assess whether we think that could be achievable or not. I personally can remember a comment at school, I think a lot of other people can relate to, that one comment that one person said that made you feel insecure about the way you look in whatever trajectory that is. And I think if they can take part in a supportive group where there isn't judgments and people and participants can be relatable to, that's going to help build their self-esteem and their resilience, and actually hopefully they won't go down the trajectory of managing in different ways. This was from a pastoral worker within a school, and they said, I thought I'd feed back to you when I was talking to a former participant today, and since half term she's been really positive and buoyant. She said the body image group was such a positive experience and gave us so much. She said that this was the general consensus amongst the group too. I think that's so lovely. We so rarely hear students talk so positively about an intervention. At the moment, what we communicate with schools is if they have anyone who is interested to complete a self-referral form, and then we will triage that and then facilitate and set the group up.
I had my first community eating disorder service assessment when I was 14. I'd been struggling with an eating disorder for a few months, but didn't recognise I needed specialist help. For years, I had body image and eating issues. But in 2017, these escalated and my family became concerned. My parents took me to the GP, who put in an emergency referral after a physical exam and learning about certain behaviours I was engaging in. For a long time, I struggled to admit my eating disorder and needed help. I felt the adults around me had different goals. They wanted me to recover and were concerned for my health, while I wanted to continue losing weight. The first few months of treatment were incredibly difficult. It felt like a constant battle between me and everyone else. Now I'm in recovery, I recognise my family and clinicians just wanted me to get better. At the time, I thought they were trying to make me fat. After a long struggle, our goals began to align. Although things were still difficult, I was finally on the same page as everyone else and ready to fight the eating disorder with their help. During my time at CEDS, I learned a massive amount about myself and my illness. Before committing to recovery, I couldn't think clearly and everything felt like a constant fight. After I began working with my clinicians, I explored my thoughts and feelings and became aware of the triggers and things I struggled with most. My treatment helped me understand the way I thought, and I began to create a new identity outside my eating disorder. I realized I didn't need to focus on getting my old life back, but rather find out who I was, what I was interested in, and what I cared about. I learned the only way treatment could be successful was if I was honest about what I needed and was prepared to stand up for myself. After that, we worked together to fight the eating disorder, and I began to recover.
Young people will work with their families alongside a professional to focus on their eating disorder and to recover their physical health and their psychological health. Other young people who are able to manage an individual approach might receive an individual therapy for an eating disorder. And alongside those therapies, all young people will be offered interventions that may include psychological interventions, psychiatric interventions, dietetic involvement, and potentially multifamily therapy. So anyone who is in the community who is concerned about a young person, whether that's their GP or whether that's their youth worker or school worker, can refer in via the single point of access to the CAMS team in Somerset. If a young person is between 16 and 18, they can self-refer. So young people that come into our service, if they have any medical concern, we will have great conversations with our paediatric colleagues who are on the end of the phone and will react within the day if we have a concern about a young person. And if young people need medical intervention, we have a planned 3-week pathway for young people, which is a very planned intervention for young people who have medical needs around restoring weight and normalising eating patterns. Please don't watch and wait with these young people. If you have a concern over a young person with their eating or their weight, we would want to have some contact from a GP. Watching and waiting can get young people unwell, and we want to be very responsive and very quick to act around young people. Our criteria is for young people with moderate to high risk of either psychiatric or physical harm from their eating disorder. Some young people don't meet that risk criteria but absolutely need an eating disorder intervention and deserve treatment. Young people can be referred very easily to SWEDA and receive a full treatment for their eating disorder from the SWEDA pathway.
I was referred to SWEDA by CAM's Community Eating Disorder Service after seeing a nurse at my local surgery, where I was diagnosed with anorexia. Whilst on the waiting list for counselling, I was offered a fortnightly 30-minute checkup with a trained professional. We talk about my feelings and sometimes do specific exercises to help with certain things. I was offered lots of resources and helpful information. From working with SWEDA, I gained some clarity and understanding of my situation, how I was feeling and why I was feeling that way. I discovered strategies to open up my mindset and become better in my own time. I wanted to talk to someone who had a greater understanding of how I was feeling and recognise what I meant. I got everything I wanted from SWEDA and much more. Talking with somebody regularly who had a greater understanding of my condition and understood the challenges I was experiencing was one of the things that helped me the most. I pieced together what made me feel the ways I did. Narrowing it down helped me identify my feelings a lot easier, which was refreshing. The part that stuck with me the most was that I am my own saviour, and getting better starts with me. My time at SWEDA helped guide me to that mindset. SWEDA were very supportive throughout my time there. They gave me lots of advice on managing my feelings, and as a result, I had more control over the situation. I'm so grateful for the support me and my parents received from this brilliant organisation.
SWEDA offers services to anybody that's affected by an eating disorder. So that could be somebody who's experienced an eating disorder themselves, or the friends and family, loved ones, other people surrounding that person. We provide a range of therapeutic services to help people recover. Those are both actual therapies and more low-level supporting services. So there's quite a lot of different ways that we support people. So SWEDA specialise in working with people in two groups really. So first of all, we work a lot with people who may have the signs and symptoms of an eating disorder but may not quite reach the criteria required to get a diagnosis, or they may not be quite ready to access an NHS specialist service, but they're still unwell and they could benefit very much from early intervention. SWEDA help people in a whole variety of ways. We offer a holistic service, we offer an all-age service. We're a very warm and friendly organisation. People can come and see us even if they're not quite sure what's going on. And we'll offer them an appointment where they can talk about their concerns, we can listen, we can help decide what the next step might be. Somerset is very lucky because it has a service for people who experience disordered eating or eating disorders at any level. So if you're not sure, for example, that this person sitting in front of you has got a full-blown eating disorder, it doesn't matter because there may still be somebody that can help, like SWEDA. And what also doesn't matter is if you send them to one service but really they're more suitable for another, because in Somerset we all talk to each other, we meet regularly, we can discuss individuals and we can make sure that they get to the place where they really need to be.
The way our organisation helps people is dependent on what the patient's individual cares and needs are. We will deliver care that can be either face-to-face or online. It can be in a group or a one-to-one session. We can also deliver help and care to their loved ones and carers. We also offer advice and consultation to GPs, community services, community teams and inpatient units, whether that's psychiatric care, eating disorders inpatient units or district general hospitals. Even if you're still unsure, I would still encourage you to refer, as we can signpost on to other services such as the community mental health teams, open mental health or SWEDA with whom we can do joint assessments. So the eating disorder service for adults and SWEDA have a monthly meeting across both teams, which is multidisciplinary, attended by specialist nurses, SWEDA, psychiatrists, dietitians and psychologists. Get in contact. We love to hear from you and we're really happy to help.
I decided to become a peer support worker because during my time with the EDSA, I felt it would be really beneficial to have someone who had actually been there in the depths and had come out the other side to, you know, it's all well and good medical professionals saying it gets better, but if they haven't been there, it's very hard when you're ill to, you know, understand that and validate it when you just think, actually, what do you know? And I think it's vital for peer support workers to be involved with eating disorder patients, to be that, you know, that message of hope and ultimately to inspire other people who are stuck. I also think it's really valuable to give back to the service that I was a part of and then hopefully start a cycle of giving back, people recovering and giving back, and the community can grow and have a more supportive and versatile support system around everyone.
Under the EDSA, they offer various services. So there's a couple of dietetics who will go through nutrition and the more physiological effects that eating disorders have on the body. We then have the nurses who can monitor you, so bloods, weight, ECGs. Depending on your treatment program, that can vary in how frequently that happens. There's a group called Mantra Group, which is the one that I did. There's also body image groups. We also have a doctor on board the EDSA team and a psychiatrist to, you know, go through meds and things like that. One of the main things is that somebody's physical condition does not attribute to their mental suffering, and we can't always look at someone and say they have an eating disorder. It's not always showing outwardly, and it shouldn't have to show outwardly in order for people to gain access to treatment. The mental impact of eating disorders is so catastrophic to not only the sufferer but to friends and families around them, and really the whole environment that the person is in needs to be supported. It's important to have multiple appointments with someone if you're suspicious or there's signs or symptoms that they have an eating disorder. One appointment isn't going to cut it. They're not going to divulge all their, you know, deepest, darkest secrets, as it were. They need multiple appointments and a good rapport with you in order to be able to even just dip their toe in the water of saying, actually, something's not right. They're very secretive disorders, and yeah, there just needs to be a more thorough investigation around if you think someone's got an eating disorder, and also don't take their first answer as the proper answer. I know in my time I wanted someone to ask a couple times and unfortunately they didn't, and I because of how ill I was, the voice in my head wouldn't let me, say it. I needed people to prod and probe. And it's very uncomfortable for the person who is obviously unwell, but that could be the moment that, you can change someone's life, or you can prevent disordered eating from becoming a full-blown eating disorder. So the extra 5 minutes in an appointment could really make the difference.